Hey guys, Dr. Davin Lin, board certified laser dermatologist. Hey, today we'll be talking about a different type of peel. We talked about an AHA glycolic acid peel early on and how to do with all the DIY tips and all. You've seen my TCA peels as to DIY with my 9%, 8% concentration. Today I'll show you how we approach an acne patient, and we're doing what's known as a lactic acid peel. So briefly, lactic acid is also called an AHA or an alpha hydroxy acid peel. It needs to be neutralized. It's weaker, generally speaking, it's weaker than a glycolic acid peel, concentration for concentration wise. And it's usually more gentle on the skin compared to a glycolic acid, but still it falls under the umbrella of an AHA or an alpha hydroxy acid peel. Lactic acid peels are one of the oldest. In fact, this is the oldest peel known to man or woman. In fact, this is called a Cleopatra peel, because if you look it up or Google it, you'll see that Cleopatra used lactic acid, not in bowls like this, but she actually used goat's milk, which produced lactic acid. So sour milk was the first invention of chemical peeling by the Egyptians thousands of years ago. Obviously, since then, we've formulated it in different strengths, different concentrations, and to deliver it in a much safer manner to treat conditions such as acne, which you'll see very shortly. So hang tight and we'll show you how it's done. So to do our lactic acid peels, which are basically like sour milk peels. And they're a form of gentle chemical peeling which can help exfoliate the skin, and we're using light treatment for your acne, yeah? Mm-hmm. So overall satisfaction rate, pretty good?
Very good, yes.
Very good, cool. Cool, so we've cleaned the skin and now we're going to put some lactic acid. Rach, what concentration of lactic acid
This is actually 40 because I know her skin.
40, wow, that is super strong. So guys, hey, just be really careful. Rachel knows what she's doing. Give me a tick, I'll just show you. This is the Aspect Doctor we're using. And it's a neutralizer out there. So here we go, we're actually peeling using 40, wow, that's a good strength. So guys, don't do this at home, please. Just see a professional. Rach over here is a professional. So Rachel's done realistically a couple of thousand peels before. Yeah. So she knows the skin backwards, and most importantly, she knows Nicola's skin backwards. I always say to if you really want good treatments, go to one person, because one person knows the skin better than anyone else. So I get my nurses to actually look after one person, so they don't go to see different nurses, especially when it comes to laser treatments and chemical peels, because that way we know how to push it up, and that's great for the patients. Is it stinging?
It does. It stings, but it's a good sting.
Good stinging? Okay.
It smells like Manuka honey.
Yeah,
really? Yeah, it's actually a really nice prep with this, with that. And Rach, so how long do you leave it on for?
I'm going to watch her skin.
Yep. And what are you looking for?
It's reacting quick, the erythema.
Good. So you're looking for redness. What else are you looking for? Asking the patient for pain, aren't you? So you're always getting feedback from the patient. How's everything going?
All good.
All good.
Still fine.
Not painful.
Nope.
Yeah. So we always ask the patient, for any chemical peel that we do, it's always the same thing. We always look. We always ask the patient. If they're in discomfort, we neutralise early. If there's a lot of erythema or redness, we neutralise early as well. So we don't take for granted what we've done before, but we're always looking, always seeing, and making sure that there's no reaction.
It's pretty clear.
It's pretty clear, pretty good.
I'm going to give it one more minute.
We're going to give it one more minute, guys. And what I've done with her regime is that I've combined. So we're going natural here. So we're using light treatment. So I'm using this electronic system. So sometimes I use red light, sometimes I use blue light, sometimes I mix it. What are we doing this time? We're using red light. Okay, so the action spectrum for the porphyrins, for the reds, actually go a lot deeper compared to the blue. So we're getting good results with using the electronic. So we'll stick to that. Sometimes what I do is I do red and blue at the same time. The reason why this light works is because it activates the porphyrins, which are found in P. acnes, which are the bacteria that cause acne. So that's the logic behind the red light. Okay, guys. So now we're neutralising it. So now it's been about how many minutes was it? You timed it?
It's been 2 minutes.
2 minutes.
And a little bit. She's just going a bit red.
Yep, and that's why we're neutralising it. So how many percent did you start off with, Rach?
20.
Yep, and then?
And then 40, and then 60.
Okay,
But
cool.
most people get a good result of 20. I just want to speed things up for Nicola a little bit.
Cool. So remember, Rach is a professional, guys, so don't just do things very slow at home. In fact, I sometimes even advocate a 5% just to be safe.
And you could probably get away with doing that.
Yeah, at home 5% and slowly go up from there because it's it's always safety first, yeah, because we're doing pretty high-end stuff. Very important. See, look what Rachel's doing. She's actually neutralising around the corners of the nose. We always can make sure that that area there, because if you're going to get burnt, that's where that happens, as well as the corners of the mouth. Sometimes, I like to put Vaseline around that area to protect QV. And she's being very careful and neutralise everything, make sure everything's off.
No.
Oh, really?
Or maybe on my lips. Like, there. That's fine.
Cool, that was easy.
Cool.
And now we're going to put it under the light.
Cool, so that's step number 1, which is lactic acid peeling for acne. And like I said, for acne, yes, I'll get a lot of comments, why don't you use BHA or an AHA? Reason being is that this patient prefers a lactic acid peel, and guess what, it works, so why am I going to change it?
Mm-hmm.
But yes, the logic behind a BHA peel, a salicylic acid peel, is there because a BHA has got anti-inflammatory properties. So, but having said that, each one to their own. I personally like my own TCA peels, but everyone has their own preference. And we're going to do the light very shortly. Okay, so we are doing the light treatment now. So Rachel's just using the electronic system. We're using red. Yes, there's an argument for blue because blue is more superficial and it does target the porphyrins better. But we're using red because it works on her.
Sometimes we use both.
So yeah, and sometimes we use both. So Rach is absolutely right. Hey Rach, look over here. Is that a hickey on your neck? Sorry. No. Okay. Oh, is that a hickey? Okay, don't worry. We'll V-beam it later. We've always got a device for everything, including hickeys. So I'll do a series on how to remove hickeys using a laser at some stage. But anyway, today it's a professional channel here. So today we're concentrating on acne and combination treatments. So this light, Rach, how long do you plan to leave this on for?
This one 16 minutes, so that's 50 joules.
50 joules, yeah.
We're going hard.
Cool. So we're going pretty hard with it. It's absolutely safe. This is also called a low-level laser emission device. It's actually just a wavelength of light. In this case, we're using 633 nanometers, which is the red light spectrum, and we're cooking it for 50. You're saying 50?
50 joules, but I might drop it just because we have peeled her.
Yeah, cool. So it's working really well for her, and that's it, guys. So I'll catch you next week. Westside Dermatology, sometimes my nurses have too much fun over the weekend, and we have a hickey. So this is the versatility of what's known as a V-beam or pulse dye laser. It actually targets the blood vessels, and it's great for bruises and sometimes for for people who have too much fun, hickeys as well. So here we go. 2 shots, 1, 2. 2 shots, 1, 2, and 1 there. And that hickey will go in a couple of days' time. Thanks for that, guys. Guys, look, thanks very much for watching this rather long video. I try to do educational videos, and I would love you to subscribe for more information. I post a video up every Saturday, Brisbane time in Australia. The other thing as well is that I am on Instagram, so I try to post maybe 2 or 3 videos a week. So if you're really bored and you want to learn something new, follow me on Instagram. Once again, thanks for watching this video, and remember to subscribe for more information. Thanks, bye.